Hello, my name is Shannon Anderson. I'm the CEO of Mental Health First Aid International, the organisation that develops and licenses mental health first aid education and curriculum worldwide. I'm also the CEO of Mental Health First Aid Australia.
Salut! I'm Dr. Claire Kelly and I'm the Director of International Programs here at Mental Health First Aid International. So one of the main tasks that I have is mentoring new licensees into our courses and helping them to adapt their courses to their local context.
The program was initially developed as a community-based initiative in the year 2000 by Betty Kitchener and Professor Tony Jorm, a husband and wife team, and has now spread to 25 countries since that time.
The Mental Health First Aid Action Plan is ALG, which stands for Approach, Assess and Assist with Any Crisis, Listen and Communicate Non-Judgmentally, Give Information and Support, Encourage Appropriate Professional Help, and Encourage Other Supports.
So in Australia, over 1 million Australians have completed mental health first aid courses, which equates to about 3.9% of our current population, and more than 4 million people have been trained in mental health first aid around the world. In Australia, we currently have 2,400 accredited instructors, and there's more than 50,000 accredited instructors around the world.
We're in the process of developing curriculum for lower and middle income countries, which is a really exciting project. One of the big projects we're working on here in Australia is a mental health first aid course designed for settings where adults are supporting children aged 6 to 12, and that can be family settings, healthcare settings, or educational settings. We are also working on various resources to support the delivery of our programs to more marginalised groups. I'm currently supporting the development of a deaf mental health first aid course, which is wonderful. It's designed by deaf curriculum developers for their own community and the Auslan community in Australia. And we are also looking forward to rolling out the mental health first aid for people with an intellectual disability course, which will help people to support people with an intellectual disability who also have a mental health problem.
For first aiders, we offer regular newsletters and information that we distribute on a regular basis, quarterly, to our first aiders. We also provide webinars and other events where first aiders are invited to attend, and they can learn about particular topics of interest or also participate in practice conversations. And we also offer refresher training for our first aiders.
There's been a lot of research on mental health first aid over the years, and a lot of that research certainly has happened here in Australia, but the research that has been conducted in other parts of the world has shown very, very similar results. So we know that mental health first aid training improves people's ability to support someone who is experiencing a mental health problem and to encourage them to seek professional help, also reduces stigmatising attitudes and improves optimism about mental health problems. But the great thing about research is that it's never finished, and we're really looking forward over the next few years to continuing to develop our research programs, look at the impact in specific workplaces and communities of rolling out the mental health first aid program, and the evaluation of new specialty products that we are developing.
So late last year, Mental Health First Aid International released our new strategic plan for the next 4 years. That strategic plan focuses on 4 key areas: education and community development, research and evaluation, program quality and delivery, and sustainable operations and growth.
It's very hard to do it in one. Can I do it in two? It's essential. Mental health first aid is essential in all countries and all communities, but it's also very, very practical.
My advice is, if you're worried about somebody, you should initiate a conversation to see how that person is going, and to also be proactive around seeking support for your own mental health.
On behalf of Mental Health First Aid International, Shannon and I would like to thank you for the opportunity to speak here at your forum. We're very much looking forward to hearing what everybody else has to share.